I wanted to spend a bit of time today talking about Ebola because we didn't get a chance last week, and this has quickly become one of the biggest events, facing us here in the West. I'll give a quick background just for our listeners who might not have been across the issue. At the moment, there's about 8,000 cases reported and about 4,000 deaths. The majority of those are in Liberia. There's been one death in US, we'll get to that in a moment, and one case in Spain. But apart from those two, it really hasn't affected countries outside of Africa the way that it has affected those African countries. The official story is that late last year, a two-year-old boy in Guinea named Emily, I think you pronounce it like that, he's considered patient zero. He died late December last year. By mid-August of this year, it had spread to Sierra Leone and Liberia. And in August of this year, those doctors from the US, Nancy Wright-Ebola and Kent Brantley, they contracted the disease in Liberia, and then they were transferred to a hospital in Atlanta. So people who supposedly had the disease were flown into the US, which at the time I was impressed to see that so many commenters on the mainstream media outlets were saying, this is ridiculous. Why would you bring back... The whole story just never made sense. A lot of people were waking up to that. Anyhow, fast forward to October 30, and so fast forward to September 30, and the CDC reported that the first case on US soil had been confirmed, like the first regular case. That was this Duncan character, Thomas Duncan. He died on October 8 at 7:50 a.m., which coincidentally was during the middle of the blood moon. But that is another topic for another show, I suppose. Now, in the US, they're stepping up their screening at major US airports, which I saw a thing on one of the mainstream outlets from the US involves asking people, are you ill? Checking if they're coughing, but also applying like an infrared non-contact scanner to check their temperature. And that's what they're doing at the moment. It's easy to foresee that the screening will become more comprehensive than this. A couple of days ago, I'm sure some of our listeners would have seen this, on a flight, it was a US Airlines flight from Philadelphia to the Dominican Republic. A man apparently sneezed and joked, I've got Ebola, you're all screwed. One of his co-passengers dobbed on him, and then next thing, all the passengers on the flight were told, you have to wait there, we have to get this guy escorted off. The 4 people who came and escorted him off were all in full hazmat gear. So you're sitting there and you're being told, look, we think there might be a bio threat here. You have to sit on this plane while we get guys dressed in hazmat to escort him off. I would like to think that most intelligent people would say, well, hold on a second here. Either you're completely overplaying the risk here, I don't want any part of it, or there's a genuine risk to me. I'm getting off the plane. Yeah. What are you... Yeah. I mean, it was so ridiculous, but in the video footage, all of these passengers are just sitting there like compliant little geese, putting their cameras up in the sky and recording it all. I mean, Lindsay, I would like to think that if this happened to you, you'd say, up yours, boys, I'm getting off this plane. Yeah.
But we've discussed this before. Even in the airports in Australia now, if you make even an offhanded joke about anything to do with terrorism or whatever, you'll be hit with the federal police who will escort you and put you in prison. So they've got us already to the point where we're so scared to backchat any sort of authority that they're just escalating it and they're getting away with it. They know what they're doing.
Yeah, absolutely. I mean, if you have 100 or 150 people on the plane and they all say, listen, there's 150 of us and maybe 10 or 20 of you, what are they going to do? Yeah. But what they depend on is no one doing that, no one banding together, and they can just walk up in hazmat suits and escort people off planes.
Yeah, but it's not just on planes. That's almost a metaphor for the whole of society.
Absolutely.
There's only a handful of them anyway, and we could wipe them out in 5 minutes. But we don't.
Which is exactly why they have to control the media the way they do.
Yeah.
So anyway, I got up to how they escorted this guy on the US Airlines flight. Now, I want to read out a quote this is an article from the Washington Post. Quick quote here. We are following the direction of and strictly adhering to all Centers for Disease Control and Prevention, that's the CDC guidelines, in place for airlines in response to the Ebola virus. The airline's statement read. This is US Airlines regarding that flight we just spoke about. The flight was checked by officials and cleared. We apologize for any inconvenience this may have caused, but the safety of our customers and employees is our first priority. And when I read about this, I thought to myself, hold on, this was in the Dominican Republic. How did they have the hazmat suits just waiting there at the airport? And why is the American CDC, why are they getting to dictate what happens on the tarmac in a place like the Dominican Republic?
Well, if you go back, remember I can't even think of his name now. There was a fellow in Mexico, I think, and they went down and just picked him up, just picked him up over drugs. They seem to be able to do anything they want in any country they want. And that's shades of Israel too. They've threatened to do that sort of thing as well.
Yeah, absolutely.
Yeah.
Well, we'll carry on with this little, because I'm just giving the background to this Ebola thing before we get into the bigger discussion. Where this story gets really interesting and relevant to all of us in the West is the declaration of public health emergency on October 7 by Daniel Malloy, who's the governor of Connecticut. Yeah. I'll read out a quote from that statement. This is a direct quote. I hereby declare a public health emergency for the state pursuant to the Connecticut General Statutes Section 131A for the duration of the epidemic. Specifically, in accordance with Connecticut General Statutes Section 19A 131B, I authorize the Commissioner of Public Health to order the isolation or quarantine under conditions prescribed by the Commissioner of Public Health of any individual or group of individuals whom the Commissioner reasonably believes to have been exposed to, infected with, or otherwise at risk of passing the Ebola virus, end quote. That was from Daniel Malloy, the governor of Connecticut, on October 7, so just a few days ago. So what he's essentially said there is, we now have the permission to apprehend anyone who we think may be at risk of Ebola. So we talk about how they've eroded our civil liberties here in Australia and they've used a terrorism threat. Well, over there, it seems as though they're using the Ebola threat to say, hey, we don't care who you think you are. All we care about is if we want to apprehend you, we'll do it. And if you can get an entire plane full of idiots to sit there on their asses while someone comes in hazmat suits and takes someone away, you better believe that if they come to your door and say, we think you might have Ebola, when all your neighbours are like, are they apprehending him? All these people have to do is say, yeah, he might have Ebola. Take him! Get rid of him. Yeah. That's how easy it is with this threat of Ebola. I'll continue the background and then we'll get into the broader discussion. Just for people who might not be aware, Connecticut is a state of about 3.5 million people in northeastern US. And it's one of the wealthier states in the US. It's like the third highest on median household income. Here's the fun part. There are no cases of Ebola in Connecticut. And that Thomas Eric Duncan character who supposedly died in Dallas, Texas, well, Dallas, Texas is about 2,500 kilometers away from Connecticut. So this would be like somebody supposedly dying of Ebola up in northern Queensland, northern at the tip of Australia, and then a politician in Sydney saying, well, now we have to take away all your rights. We can just apprehend you because you might have Ebola. That's the situation that we find ourselves in now. That's why this Ebola story is so serious. I'll give a little bit more information. The Center for Disease Control and Prevention, who I mentioned just before, have a site on the page on their site entitled Legal Authorities for Isolation and Quarantine. I'll read out a quote from that page. Quarantine is used to separate and restrict the movement of well persons, I'll repeat that, well persons, who may have been exposed to a communicable disease to see if they become ill. These people may have been exposed to a disease and do not know it, or they may have the disease but do not show symptoms. Quarantine can also help limit the spread of communicable disease. So what is this saying? So even by the CDC's own website definition, they're saying if we have the right to quarantine, we can quarantine you even if you have no symptoms, just in case you get ill. And the page lists which diseases this applies to. And then it says, and again I'll quote, federal isolation and quarantine are authorized by executive order of the president. The president can revise this list by executive order. End quote. So in other words, this isn't even just about Ebola. I mean, they could make up any disease they want, and right now they've already set people up with all the fear in the media, with all these clearly fake stories on CNN and ABC of people supposedly having Ebola, and they've set the scene now. All they have to do is say, we think you might be at risk because you might have a disease. We can take you away, and here's the best part. No one's going to come to your aid, right? Because you're all just as scared as each other. We've got the hazmat suits. We're marching your way. So that's the background, boys. What do you think?
Yeah. Well, my concern with it is, can they give you vaccinations compulsorily? I don't think they get at the moment. They couldn't. I think from in America and the same in Australia. But will this allow them to give you vaccinations?
That's a good question. I've read reports from alternative media outlets and from YouTubers that means they can give you vaccinations. in all the research that I've done so far, I haven't found any official sources
Okay.
that state that. Obviously, I'm trying to stick to what they've officially said. I mean,
okay.
if you just look at their website, they're officially saying we can take you away for anything.
Yeah.
I haven't found them admit or to state on their own website that they can, inoculate you or whatever. But obviously, my expectation would be, of course, that's what they can do.
Okay.
Because that's where I think, and this is where I want to get into a conversation with you two about it, that's where I think this is headed, is forced vaccination.
Forced vaccination. And then they're liable to give you the symptoms. So then suddenly they find, oh, you have got the symptoms because they've given you something that'll, anyway. And I think they're going to get into boggy ground here because there are an awful lot of people in America and in Australia who really don't want vaccinations under any circumstances because we just don't trust them. Well, anyway, I'll let you talk about that.
Yeah, well, one thing that it got me is it's hard to actually, because I'm conflicted on the whole Ebola thing, whether it's a fabricated thing, whether people have been, intentionally made sick, as you've said, through some of these things to justify it, or whether if it is real, or it's been intentionally allowed to be spread, which is clearly obvious. Yeah. But it's one thing to relate to is it's hard to get through all this propaganda and this mainstream deception to try and these blatant fear tactics to try and actually, pin down the actual representation, because it's hard when a pharmaceutical industry and a scientific community that are all bought and paid for by the same people that are pushing whatever they want through the media and through their agenda. The same people that are funded by them are the ones that are giving you the information about this when you go back to the actual original sources of it. So it's hard. And one thing I related to a friend the other day, and this is just the purpose of the relation means to it. We were talking about political ideologies and living under, communism or socialism or, socialist democracy or, democracy, or which system would be the best. And I said, it's hard because we've never lived in I personally have never lived in a country that's been under communist, or a dictatorship or, a socialist country. And all I'm reading about these ideologies is what I see in the history books written by a country that tells me that this is democracy, when it's clearly not democracy. We're not living in a democracy. We've never had a chance to live in a democracy. We're given the illusion of freedom. So I relate that deception back to the Ebola thing is, it's hard for us to even through alternative sources to get the legitimate information about this. And all the public is being, forced upon through their subconscious is this fear that Ebola is everywhere. And it's justifying, what Johnno just spoke on about, rounding anyone up. And it's just madness. And I think it is being used as similar to what the terrorism threat over here is. Ebola is, Ebola's the boogeyman over there. And it's just what happened with swine flu. Swine flu was supposed to be the most, devastating pandemic ever. Supposedly 27 people or so died. Give me a break.
And
Johnno, what do you think?
It leads you to wonder, that swine flu thing, because again, that was a very comprehensive fear campaign that they had back then. I had a friend who was studying in Mexico at the time, and they ended their semester early, so she got to just spend more time traveling. But that's how serious the swine flu. We might have forgotten just how serious it was, or at least how serious they told us it was. And sometimes you wonder, was that like a test? I mean, the people who do this, the people at the very top, they're very intelligent, more intelligent than me. They work together. They're smart. They would be smart enough to do a little practice test to see how easy it is to manipulate people into the fear. And then a few years later, hey, now we've got the Big Daddy fear campaign, and it's Ebola. Now, as you guys know, I don't watch as much mainstream news, perhaps as some people do. I wasn't aware, you guys were telling me off air, that there was reporting on our 6 p.m. bulletins that there was a suspected Ebola case in Cairns or something. Is this right?
Yeah, that's correct, There's a woman up there she got a fever. She'd been working in Africa, came back, and felt that she had a fever, and bang, they whacked the whole bit, put her in isolation, and anyway, air conditioning that's non-pressured or something, and so it wouldn't disperse throughout the rest of the hospital. We're waiting till Monday, apparently, for the final rundown to see whether she actually has got it or not. But that's just the same thing. It was just a beat up. I mean, normally, under normal circumstances, you say, oh, a woman's got a fever, or thinks she's got a fever, we'll see what's going on. Mm-hmm. But no, bang, it's Ebola.
Yeah.
This was on a 6 p.m. bulletin, was it, on the news?
It's been on every day.
It was rotating as the top story. Thursday afternoon, Friday morning, it was just rotating.
Yeah,
we returned to our top story because there's news every half an hour in this country on every network. 4:30 news. Join us for the 5 o'clock news when then we'll be back at 6 o'clock for the news. Then 7 o'clock is the project. It's news, but news done differently. But it was just a recurring thing. Ebola.
So this is actually their lead story.
Yep. And my friend who I was with at the time, we did a little experiment and we said we're going to change between every channel and it's going to be the same thing.
So, yeah.
And we changed to Channel 10. Ebola scare, lady in Queensland. And then we changed to Channel 9. Our top story, Ebola. And they were pretty much reading off the same script. It was unbelievable. But they were making it even more exaggerated because they had no footage of the lady or any information. They were just showing recurring footage of people in these, African countries going through, from like 10, 20 years ago, just people, going through bushes, and then they're showing, these poor African, people, and then they were showing United States footage of people in their gas masks and everything, just saying. And it said, lady shows symptoms of low fever. It could be Ebola. And I was just going, this is absolutely unbelievable. So that's, you're lucky you missed out on it, Johnno, because it was an absolute bombardment. And it went on for most of Thursday and Friday. It's just unbelievable.
Can I come in with, I was looking at the Jim Stone freelance site, and he had a CNN video that had been pulled. And it had a young kid, about 12, and he walks in, this is in Africa, and he walks in, looking around, bouncing along, and then suddenly just lies on the ground. Oh, he's got Ebola. It was so farcical, and obviously that's why they pulled it. I could be guffawing. It's almost like me when I looked at them cutting their throats on the ISIS cutting their throat. You just fall about laughing. It's so bloody ridiculous. But anyway,
there was that segment, I think it was ABC News from like a week ago, of a guy supposedly in West Africa watching as a hazmat crew were cleaning up a dead body. And it's like, this 31-year-old man, no one came to help him, and now he's dead. There's like hundreds of people, 50 feet away, all blocked off. The whole thing clearly staged. And then what happens? Hold on, he's not dead. He's moving his finger. He's not dead. Like, they're pushing this meme of, zombie virus. Like, people coming back to life and playing into, I guess, fears that have been put into people's minds from all of the mainstream films. Outbreak or Contagion or 28 Days Later. All of these films that, push this idea of viruses that don't just kill you, but change your behavior or maybe even help you come back to life or be like the undead. I think there might well be an agenda here to tip into that fear.
Well, one of the most popular shows on TV right now is The Walking Dead, where the virus spread throughout humanity, and now most of the people are, walking dead. They're not zombies. They're people that caught this virus and now they, live. But everyone's infected in the show, and once a person dies, they then rise as one of these dead, and it's. You know what I mean? It's eerily familiar to, what's the narrative that they're trying to push subliminally in parts about, this Ebola virus. And I just think it's just ironic how throughout all of media, through pushing through wars, through pushing, movies about wars, movies about aliens, movies about, all of these things, that we're being programmed to somehow believe this. So when they come out and say that they're going to start rounding up people say, well, we saw it in the movies, you know what I mean? We don't want that to happen, like what happened in the movies. And it's, programming us to believe things a certain way, just as, it has all throughout history. That's what that's what film is for. That's what television is for. That's what the news is for every night. It's unbelievable.
Well, I can remember about 10 years ago, maybe a bit more than that, I noticed that there were articles in the paper about we're going to have to eat our dead. Do you ever recall any of this?
No.
No. I'm not exaggerating. And it wasn't once. It come up 2, 3, 4 times. You see it in different publications. And I thought, what's going on here? There's something's not right here. And then that's drifted away. And I'm just wondering whether that was the start of this lunacy about.
Yeah, well, who knows?
Zombies
as I said, it's hard to get through the deception. It's hard to piece together things when you're being told a certain way, and that's interesting.
Yeah. No, it was really odd. It was. I can remember it because I was heightened. What's going on here? Why would they suddenly have 3 or 4 stories on this? Obviously, nobody's going to buy into this, but they were pushing it, and then it's gone by the way now. So I don't know what the background.
Well, a perfect example of true history is when they broadcast the War of the Worlds broadcast. And, people believed it was a real alien invasion. And then, there was people in their cars trying to flee cities and they used, it served as the perfect pretext to understand how people can react to this. Yeah. And then, you know what I mean? And things like that are being drilled into the subconscious of the people.
Yeah, I like those stories, like those historical examples of where people have been manipulated into frenzy or fear. You mentioned the War of the Worlds back when people used to listen to radio shows and they believed that one was real. Just today I was reading an independent article about possible conscription here in Australia. And of course it was about 50 years ago, almost to the month, where conscription was brought in for Vietnam, and they showed archival footage from ABC of people on the streets, like, interviewers on the street asking people, do you think we should be going into Vietnam? Now, I'm sure even 50 years ago, just like today, they edit out all the people who say no and just show the people who say yes to help manipulate the people, because we're herd animals. If you're sitting there at home and you're watching the news and they ask everyone, do you support the war we're going to? The average sheep, if you see 5 people on the TV go, yep, I support it, you're more likely to go, yeah, I support it too. So they intentionally filter out the people who don't agree. What was interesting was the justification given by these people back in Australia, back in 1964, for supporting sending people to Vietnam. And sure enough, they're talking about the communists. And for us today, it's such a ridiculous notion. But with any luck, if there are still intelligent people who are allowed to read books in 50 years, they'll look back and say, you want to go into Iraq to bomb people because of ISIS beheadings? But yes, that's what people want because they've been programmed that way. Why do you think they call them television programs? It's an in-joke. They are programming us. And how do they do that? With broadcasts. Think about this word. It's a broadcast. They're just catching you with like fish. It's that easy for them. They're broadcasting programs. They're telling you what you're doing. But you click the little remote at 6 o'clock and you'd say, hey, tell me what to think.